Good morning. Thank you for joining us on this beautiful but a little chilly day. We're here today to discuss a very serious problem, congenital heart defects, or CHD, and a bill I have authored that would require pulse oximetry testing. This quick blood oxygen test detects defects in newborns before they even leave the hospital. Can you imagine a test that would do that before the child would even leave the hospital? Before I share more details on the bill, there are several people here today that I need to acknowledge. First of all, I want to thank the American Heart Association for its input on this bill and its continued hard work on this issue. Jen Ebersol, the Pennsylvania Government Relations Director for the American Heart Association, is joining us here today, and she will talk more specifically about CHD and their organization's efforts. Also, we have with us today several people whose lives have been impacted by congenital heart defects. A few of them are from the Scranton area near my home district. Lisa Scarfo will share the story of her son Jack, who is with us today. He was born with a heart defect. Jack has tetralogy of Fallot, a CHD. Two other Scranton area children, Jack and McKenna, are included in the Faces of Hope gallery that you see behind me. Thank you to all of you for being with us today. I introduced House Bill 1420 because congenital heart defects impact approximately 8 in every 1,000 live births. CHD is the most common birth defect in the United States and the leading killer of infants with a birth defect. Nearly 1 in 3 babies born with a heart defect dies. This bill is essential. I repeat, it's essential because right now, many heart defects in newborns are going undetected. In fact, many of those defects are life-threatening, but newborns may show no symptoms at birth. Recent studies have shown that wider use of this very simple pulse oximetry testing could detect 90% of congenital heart defects. As things currently stand, it is estimated that around 300 infants every year go home with an undetected heart defect that will eventually cause serious complications. The cost to conduct this essential pulse oximetry screening is roughly $1 to $4 a test. $1 to $4 that could save a life. One study calculated that the savings in healthcare costs from the prevention of 1 case of complications of circulatory collapse resulting from an undiagnosed defect might exceed the cost of screening 2,000 newborns. This has not gone unnoticed by the federal government. In fact, the Department of Health and Human Services has recommended that pulse oximetry testing be added to the list of standard procedures conducted following a baby's birth. Several states have already followed through, making this testing mandatory before a newborn is discharged from the hospital. Dr. Thomas Chin, professor and chief of cardiology for the Department of Pediatrics at Penn State Hershey Children's Hospital, is joining us here today to speak about CHD and the importance of this newborn screening. This is an issue I deeply care about, and I am dedicated to advocating for pulse oximetry testing to my colleagues in both the House and the Senate. I'll be working with the American Heart Association to inform members of congenital heart defects and the difference early detection can make on a child's life. We also plan to meet with Lieutenant Governor Jim Cawley to speak to him about this bill. I'm honored today to introduce and thank House Human Services Committee Chairman Jean DiGirolamo for joining me at today's press conference. House Bill 1420, requiring pulse oximetry testing, is currently with Jean's committee. It is scheduled for consideration by the committee next month in October. So I would like to thank Gene and welcome him right now for a few comments. Chairman DiGirolamo.
Thanks, Karen. Good work. That was terrific. Yep. This is all. I mean, I'm just proud and honored to stand here with Representative Boback, and we have other members of the General Assembly, Representative Snyder and Representative Oberlander with us, but especially with the families that are behind me today. And I want to commend Representative Boback for her passion and commitment to this issue. We're only all standing here because of hard work, and also the hard work not only on this issue of the American Heart Association, the good work that they do in the state of Pennsylvania each and every day. And I'm going to commit to you right now and promise you we're going to move this bill out of committee. We are absolutely going to bring this bill up for a vote in committee. Liz Yarnell is here with me, who is one of my staff people on the committee, and we're going to move the bill. I think we have a date scheduled in October 21st or 22nd, and we're going to move your bill, Karen. We're going to bring it up and move the bill, and then it'll be up. Then we get a vote in the full House and try to get the bill over in the Senate. But it just makes common sense to do this. It really does. If we can't protect our children, and the test is so inexpensive, $1 to $4, did you say, Karen, for this test? It's so inexpensive, it just makes common sense to do this. And if we can't do things to protect our children, what are we here for in Harrisburg? So again, it is just an honor to stand here with you today. I want to commend again Representative Boback for her hard work and commitment to this issue. It's something we've got to get done. We've got to protect the children and the babies all across the state of Pennsylvania. This makes absolute sense, and we're going to get it done, and we're going to move the bill out of committee. Thank you all. Good to be with you. Yep.
Thank you to our chairman. Next, Professor and Chief of Cardiology for the Department of Pediatrics at Penn State Hershey Children's Hospital. It's my pleasure and privilege to introduce Dr. Thomas Chin.
Thank you, Representative Boback, Mr. DiGirolamo. Thank you for the opportunity to speak a few words regarding the medical support behind this initiative. First, I would like to thank Representative Boback for bringing this to the attention of the state of Pennsylvania, and also bringing this to action and supporting it through the legislature. I have been in the state of Pennsylvania now for approximately 6 months, having spent 11 years as the Director of Pediatric Cardiology in the state of Tennessee, at the University of Tennessee, and have had some experience in seeing how this goes into effect. First, let me say that this has the overwhelming support of all the medical community. There are joint statements that are produced by the American Academy of Pediatrics, the American Heart Association, as well as the American College of Cardiology, all supporting this, and that has been enacted as of 2011. Now, within the state of Tennessee, for example, the number of deliveries per year is comparable to what we see in Pennsylvania. And in the 1.5 years since they enacted their legislation, there have been already 6 to 7 patients whose lives have been dramatically altered by initiating the screening examination. So, a brief rundown, again repeating that approximately 1% of children that are born have some type of congenital heart defect, a heart defect that is present at the time of birth, a structural abnormality of the heart. Approximately 10 to 20% of these patients have such severe defects that if they're not acted on in the newborn period, they will have severe consequences, either a critical outcome or else even death in that newborn period. It is only with the addition of the pulse oximetry that we'd be able to detect a significant number of these patients. In other words, the physical examination alone, standard vital signs that are obtained on infants in the newborn period, will often not be adequate to detect these critical forms of congenital heart disease. So what is involved in an actual pulse oximetry testing? I've brought an example here to give you a little bit of an idea of what would be involved with this. As proposed in many of the states that have enacted this legislation, children would have a pulse oximetry screen prior to discharge from all newborn nurseries. So this piece of equipment costs approximately $3,000 and can be used repetitively for all the children that are being discharged from a hospital. This is not too dissimilar from obtaining a blood pressure, which is routinely done already in children. This is a little probe that wraps around the hands and the feet of the children and is able to tell us what the oxygen level of the blood is prior to their discharge. So what has been the estimate of costs that are involved with doing a pulse oximetry screen on all our children? In states that have enacted this, the cost has been somewhere between $1 and $13 per child, and it's a bundled charge, which is obtained at the same time as the other newborn screen exams. So in other words, people who are getting their PKU exams, getting their blood pressures, vital signs, would have this done at the same time for the same bundled charge as what's already existing to the hospital. So in other words, for the cost of approximately a hamburger, all of your children could be screened with their oxygen levels and could potentially have their lives saved by detection of a serious congenital heart defect. Now, the screening is one step. This is something that can be broadly applied to our general population, and children who are detected as having a positive screen can go on to have more significant screens, for example, echocardiograms and full cardiac evaluations. But for the majority of children, this is not going to be required. So, to bring my comments to a close, I thank Representative Boback, DiGirolamo, and particularly the families of these children who have all had their lives affected by detection of heart defects to make a presence here and talk to you about how important this legislation is. Thank you very much.
Next, I would like to introduce Jen Ebersol, the Pennsylvania Government Relations Director for the American Heart Association. Jen.
Thank you so much. And on behalf of the American Heart Association, I do just want to really take a moment to thank Representative Boback sincerely for her leadership on this issue. She has just been a gem to work with, and we are so pleased to have found such a passionate and dedicated advocate for us in the General Assembly. I also want to thank Chairman DiGirolamo for his commitment to bring the bill up for a vote in committee. We're very excited about that. So I hope some of that excitement will ring through in our meetings following this press conference. Dr. Chino and Penn State Hershey Children's Hospital, thank you so much for being here and for sharing your clinical thoughts onto this issue as well. And of course, all the families that are behind us today, you know, they're really the ones that are the faces of this issue, and I can talk a little bit more about that in a moment. As you've heard, for those newborns that have a critical congenital heart defect, time really is of the essence, because if it is left undetected, our most precious hope for the future are at significant risk for death or disability if their condition is not diagnosed soon after birth. And that's really why House Bill 1420 is so vitally important. It literally will save the lives of our next generation to come, and it gives Pennsylvania families hope that their most precious gift in life can have a fighting chance at surviving CHD if it's detected early. Pulse oximetry screening, as Dr. Chin mentioned, it is widely accepted by the medical organizations, the Department of Health and Human Services, the American Heart Association, and the American College of Cardiology, which actually Dr. Chin was brought to us through the American College of Cardiology, so I'd like to thank them as well. An ever-growing number of states are actually enacting similar legislation to House Bill 1420 and requiring pulse ox screening. And we expect that over the next couple of years, most, if not all states, are going to be acting in the same way. There's such a large influx of interest in this issue that we see a lot of states that are starting to pass laws like this. The American Heart Association is honored and privileged to have with us today several brave young children and their families who represent our hope for the future. All of the children here today and the 11 children represented on the posters that you see behind us have at least one or several forms of congenital heart defects. They've been in the trenches to fight this horrible disease. Their families have been on that roller coaster ride of experiencing extreme joy of welcoming a new baby into their family and then being told that their child has a life-threatening disease and immediate treatment is necessary. They've waited nervously and anxiously as the hands of skilled pediatric cardiologists performed surgery on the tiniest of hearts, and in many cases, several times before reaching their first birthday. They've also educated themselves to know what to look for if their child goes into distress. It gives me great pleasure to officially unveil our Faces of Hope gallery behind us, featuring 11 young heroes of heart from all corners of Pennsylvania to help depict the lives we are seeking to save through successful passage of House Bill 1420. We have 5 of those children and their families here with us in Harrisburg today to meet with lawmakers and explain firsthand why House Bill 1420 is truly a life-saving bill. You will be hearing from one of these brave mothers in just a minute, but I do want to take a moment to recognize those families who are here to us. We have Lisa, Donnie, Jack, and Nathan Scarfo from Scranton, over here. We have Amanda, Jonathan, and Veda Evans from Old Forge. We have Lee McIntosh and Shannon Witkowski from Beaver, Pennsylvania. We have Dana, Paul, and Sam Vlasics from Nazareth, Pennsylvania. And we have Marissa and Dan Allen and Xavier Trouterman from Lidditz, Pennsylvania here with us today. So on behalf of the American Heart Association, thank you, Representative Boback, for being our hero and our hope in the General Assembly by championing House Bill 1420. And thank you to these fascinating families and their children for stepping out and helping to be a voice and the face of this life-saving legislation. Thank you.
Thank you, Jen. And next, I bring to you Lisa Scarfo and her son, Jack. Lisa, will you please say a few words?
Thank you. My name is Lisa Scarfo, and I'm here today with my husband, Donnie, and our twin boys, Jack and Nathan, who are 5 years old. Our pulse ox journey and journey with congenital heart disease actually started earlier than the birth of our twins. In 2002, my best friend gave birth to her daughter, McKenna Cole. McKenna is actually pictured behind us and is 11 years old today. McKenna was not prenatally diagnosed with her congenital heart defect and was actually discharged from the hospital without being diagnosed. Her father was actually picking up the car to go and get them, and a nurse in the nursery noticed that her coloring was a little bit off. And she actually did a series of tests, pulse oximetry included, which indicated that McKenna had a severe critical congenital heart defect. Her heart defect is actually hypoplastic left heart syndrome, and without surgery within the first 48 hours of birth, McKenna would have passed away. She was immediately life-flighted and had her life-saving surgeries within the next 3 years, and as I said earlier, is 11 years old today. For her personally, pulse ox was an important tool in actually saving her life. If you fast forward a bit to 2008 when our boys were born, we actually were fortunate enough to have the benefit of prenatal diagnosis. However, in our case, that was because our boys were twins. We had several high-level ultrasounds, and it was because I was already a high-risk pregnancy that we were able to have those benefits available to us. As I said, Jack was prenatally diagnosed, and for that reason, our delivery plan was a little bit different. We were able to deliver at a hospital that was able to make accommodations for us. And for us, pulse ox took a little bit different route because that was an important indicator as to when Jack was going to be in heart failure. So we used that tool to literally test his oxygen levels pretty much every day and see when they were starting to fail and when open heart surgery would become inevitable. Jack had his open heart surgery at 3 months old and is doing wonderfully today. As you can see him running behind me, he is full of energy and you would never know anything was wrong. He will remain under the care of a cardiologist for the rest of his life, and we have kind of made it our mission to go ahead and tell our story and share our story with as many people as possible. Congenital heart defects are the #1 killer of infants, and for us, that journey has become so much more personal, of course, through our own experience, but then through all the families that we have met through our advocacy and through raising awareness. I have met many, many people who have not been prenatally diagnosed, and for some of those people, their stories did not end nearly as well as ours did. So I appreciate everyone taking the time to listen to our story today. I hope everyone understands the importance of this bill and what it will mean to so many children. For the cost of anywhere from $1 to $13, it is worth it to have that plan in place. If it were your child, you would want this test, which is completely non-invasive, cost-effective, and life-saving, to be administered to your child. I've actually had it compared to costing as much as a diaper change in the hospital. Between what it takes as far as equipment and nursing capabilities, it is the cost of a diaper change. So for that, I thank everyone for their support, and I ask you to continue to support this bill and recognize the importance of it. It means so much to families like ours. Thank you.
Thank you very much, Lisa. In conclusion, thank you all for your support. I am advocating for this legislation, House Bill 1240, not only as a legislator, but as a mother. And I stand firmly with every parent in Pennsylvania on behalf of pulse oximetry screening. Thank you very much.
Thank you. Thank you. Go right up there.